My name is Kelly Whittick. I am the Director of Health and Wellbeing at Wespath, and I will be your presenter today. I want to thank you all for joining, and I also really want to thank the North Carolina Conference benefits staff for helping us set this up, inviting you all to join it, for helping us identify what the most important things to share with you today will be. I also have on the line Bob Gerlach and Cheryl Hatcher, both from our Benefit Plans Department at Wespath, and they will be assisting with some of the technical aspects of the webinar, in addition to the fact that Bob will be answering some questions live in the questions box. So you should see a box that says questions. You can ask any question you have there. If it's private, you can ask it and only Bob will see it, and you can ask him to answer it privately. If he does think that others might benefit from hearing it, he may, with your permission, would share it publicly, and may ask me to answer it, or he may answer it as part of our Q&A. So that is the plan for today. In order for you to be able to fully see the screen, I want to make sure, I'm going to shut off my camera, but I wanted to at least say hello and let you know who the voice is today, who's going to be chatting with you. So I'm going to turn off that camera. I believe you can all see my pretty green apple and a stethoscope on the slide deck, and we're going to go ahead and get started. And we will make sure that this recording, as well as the slides, are available to you after the fact, after the presentation is over. All right, so let's dig in. In 2024, you have a certain number of options available to you through HealthFlex, your health plan. And HealthFlex is the plan that's offered through Wespath and adopted by the North Carolina Conference. These 6 medical, pharmacy, and behavioral health plans are currently available to you in 2024. They will continue to be available in 2025. I know we had some changes in 2024. If you remember, those were primarily to the HSA plans in response to a change in what was allowed to be the lowest deductible for HSA plans. And so we made changes in 2024. The same plans will be available in 2025. Most of you have access to 3 dental plans. The dental HMO is zip code driven. So if you have never seen that, it's probably because you don't have any HMO dentists in your area. It's a narrower network. And then we have the 3 vision plans. The exam core just includes the eye exam, and that's available to you if you enroll in a medical plan with $0 premium. And then the full service and premier plans are buy-up plans. You know, one of the things that we always hear is, oh, why are our healthcare costs going up so much? Why are our health insurance costs going up so much? So I wanted to spend a little bit of time telling you why costs go up each year. With HealthFlex, we truly have a very thin administrative margin. It's less than 10% of the total premium that we collect actually goes to paid for administration. I think it's about 6% in the most recent year. So the vast majority of your premiums are based on actual claims that we anticipate having to pay on behalf of the individuals in North Carolina Conference who are enrolled in the plan. And we provide the rates for 2025, which is what we're talking about here. Back in February, we actually provided them, February of this year. And so in order to develop those, we actually looked at claims from 2023. For the entire HealthFlex group, we looked at claims from 2022 and 2023, but of course we didn't have your claims for 2023. And then we look at those claims from, 22 and 23 and have to project how much we think that claims will cost in 2025. And thankfully, we have some very intelligent and skilled actuaries that work with us to help us do that. But you have to make some assumptions, and historically our assumptions have been pretty spot on. The reason that we expect higher costs in the future, in part, are due to medical inflation, which may or may not keep pace with actual inflation, like consumer inflation. There's also like new and exciting and often life-saving medications and services, treatments that are available. And those almost always come with a very big price tag. on them. And none of us would want those to not be allowed to be covered in the plans. Think about the GLP-1 medications that some folks are taking to help them get to a healthier weight and a healthier metabolism. Nobody would want us to stop covering those, but in order to cover those, you have to anticipate some increases to claims costs in the future. So when we look back, when North Carolina came to us in 2023, shortly thereafter, we gave you your rates for 2024 this year, and we gave you all an 8% rate increase. And that might have felt really high, but the average HealthFlex plan sponsor, most of the annual conferences got almost a 12% increase, and some got as much as 18%. So we actually gave North Carolina less than the average because, again, we didn't have a ton of claims experience for you. And really the same thing happened in 2025. So we had a much better year overall, and we were able to keep the average to a 4% increase for 2025. Some conferences got as much as 7%. We chose to give North Carolina about a 3% increase. Whether you come with Wespath or whether you had a different insurer when you had your own plan, cost increases from year to year are expected, especially with some of the big improvements and changes in healthcare. But what Wespath does to try to keep the cost increases to a minimum, we do a couple of different things. Number one, we have the robust well-being offerings, and we have seen some of those have a very positive impact on not only health risks, but actually healthcare costs. And we can do that without, paying attention to what individual costs that our individuals are earning. We can de-identify that, keep your privacy, but still kind of pay attention to whether our programs are having an impact. As you know, this year we newly introduced the Quantum Care Coordination Program, the Wespath Care Coordinators. And, the biggest reason that we implemented that is to help you. But what we also expect from that is that the care coordinators will help you be better consumers of healthcare and choose things that are higher value services instead of just higher cost services. So we're very excited about that. Another area that we look at is very aggressive pharmacy benefit negotiations. We contract with a number of other denominations, or we do RFPs with a number of other denominations so that we have prices that are based on hundreds of thousands of lives instead of tens of thousands of lives. And that really allows us to get better pricing for you all. And you might shake your head and be like, oh my gosh, but drugs still cost so much, and they do. Healthcare costs so much, but there are a lot of things that Wespath does on your behalf and on behalf of the conference to try to keep the cost increases to a minimum. And I do want to remind you, I want to invite you, it's okay to answer questions, or it's okay to ask questions. So please do. In 2023, North Carolina Conference had about $1.4 million in high cost claims across about 14 people. This is very typical with our other annual conferences, that we see that the vast majority of claims are driven by individuals with very high cost catastrophic claims. So that's not uncommon, but it's part of why group health insurance is so important, is to protect those individuals who are having catastrophic claims years, because none of us know when that's going to be us. I've been very healthy my whole life. I had a very healthy pregnancy. And then I had a child with some very significant, health conditions at birth. And suddenly we were in the hundreds of thousands of dollars claims. And I never anticipated that would be us. And that could be anybody at any time, which is why group health insurance matters. In North Carolina, we are seeing more than the HealthFlex average number of people who are enrolling in the lowest cost plans. I have H2000 here. I actually mean H2500 and the in 2023, it was the H25 or the 2000 and the H3000. In 2024, it's the H2500 and the H5000. So we have above average enrollment in those plans, and I'll talk a little bit more about that later. We're also seeing above average utilization of Virgin Pulse, which is great. Um, but we're seeing the North Carolina folks below average in terms of how many people are taking advantage of their Blueprint for Wellness screening, which is totally no charge to you as an individual. Plus, you get $100 for taking it. And it's a really great preventive tool to share with your physician. We have below average participation in health coaching, as well as below average number of people achieving the $150 wellness credit incentive. And when we look at health check data, and remember, this is also de-identified, we're not looking at individual health check results, but rather the population as a whole, we're seeing that the North Carolina population appears higher risk than our average HealthFlex conference, particularly in the areas of stress. So higher risk associated with stress, higher risk associated with maybe not enough social support, and higher nutrition risk or dietary risk. So those are just some ways that you compare. I have a number of questions in the chat, and I'm going to answer a couple of them, but then I'm going to go ahead and keep on going. So we have 41 plan sponsors in HealthFlex, and about 36 of them are annual conferences. So we cover most of the annual conferences in the U.S. Typically, our average age is in the range of 52 years old for primary participants, and that's a lot higher than a typical like employer plan. So clergy on average are older and unfortunately less healthy than a typical employer. And we will talk a little bit about preventive care. So I have a comment about preventive care, and we will talk a little bit about that later. All right. So in the past, the approach the North Carolina conference took to cost sharing was to, you had a couple of plans, and the approach was increase the pastor or the member portion for each plan by the same percent or the same dollar amount each year. And the objective was, overall to be fair, regardless of which plan people enrolled with. And the conference did that same thing moving into 2024. They tried to, evenly increase the pastor or member share for each plan. And the goal was just to make it simple and easy for you all. One challenge we identified with the conference staff is that what happened this year with 2024 is that the monthly premium costs in Alex and the R system when you were making your election didn't always match the actual amounts you were being billed. And the conference did a great job of communicating what you would actually be billed. But for me, this is confusing. And for some of you, it might be as well. And so we were chatting with the staff this year and really wanting to try to find a way to make things less confusing. Another thing that is a challenge with this approach is when you change the plan design or the plan values, which we did with some of the HSA plans from 23 to 24, it can throw off the calculations a little bit. And we did see that, particularly with the H2500 in 2024. We've been working really hard with the conference to try to make some recommendations for cost sharing for 2025. So what our recommendation is, and what we see most HealthFlex conferences doing, is that the member share for each plan, each of the 6 plans, is calculated based on a fixed premium credit that applies the same to all plans. And then the church share is calculated by determining how much each church needs to contribute in order to fully fund everybody's premium credit. And I'll share a little bit more in terms of numbers, but really the objectives about fairness and equity are the same with this approach versus your own approach. The added benefit that we think that you get from this approach is that we can be very transparent about what the plans actually cost. And that transparency is important so that you can understand, how much it truly costs to pay for healthcare. So these are the premium credits for 2025 that, together with the conference that Wespath has modeled and that the conference is recommending for 2025. So $867 a month for people with single coverage, $1,563 a month for people who are covering 2 individuals, and $2,144 a month for people covering 3 or more individuals. Now, the premium credit works kind of like a gift card is how I like to think of it, right? So the conference is, or your church is giving you this gift card Depending on how many people you cover, you have a different gift card. And everybody gets this gift card regardless of which plan you choose. So no matter which plan you choose, basically you're going to subtract your gift card amount each month from the actual monthly premium of the plan, which is set by Wespath based on those predictions about how much we think we're going to pay in claims in 2025. And it doesn't change. This fixed amount that the conference and churches are contributing doesn't change based on what plan you choose. And then the conference does some calculations, and Wespath has helped them model that to try to figure out, okay, if these are the premium credits based on who we think is going to enroll in what level of coverage, how much do we think we need to charge the churches? Because most conferences, including North Carolina, want to charge all the churches the same amount, not different amounts based on whether they have a single pastor or a pastor with, 4 kids. And so every church gets billed the same amount, which has been calculated based on these premium credits. So then you have your multiple options and you shop with your gift card like premium credit, and whatever is left of premium after you choose your plan, after you apply the credit, that's the amount that the pastor or the employee is responsible for having withheld from their paycheck. Now, the thing with the HealthFlex plans is there are plans that cost more, and by paying more to be on those plans each month means that you're going to pay less when you go to see a doctor or get a medication. And then there are plans that you pay less for each month, and then they're going to have a higher cost when you actually go see services. This is hard to kind of imagine in your mind, and we have a couple of illustrations later on to help you with this, but none of these are better or worse plans than the other. It's really about what is your preference. Do you prefer to pay upfront in higher premiums, or do you prefer to pay when you actually go get the service? For me, I've been enrolled in the lower cost plans since we offered them. So my preference is to save the money on my premiums, knowing that I'm going to pay more out of pocket when I go to see somebody. But other people prefer to pay more in premiums just to have the confidence and comfort of not having to pay as much when they go see somebody. There is no right or wrong answer. There's only what's right or wrong for you. So for 2025, these are the proposed member shares for each plan. So this would be the pastor share for each plan, depending on which plan you choose and depending on how many people you cover. I do want to share that because we're using the premium credit strategy for this, we are not like every plan, the member share isn't increasing by the same amount. The biggest percent increase is going to be for the H5000. That's because the dollar amounts are so much smaller than the other plans. So when you look at the actual dollar amount increase, it's not significantly more than we see changing for the other plans. The smallest increase is actually a reduction, and that will be for the H2500 plan. And you'll actually pay less for the H2500 in 2025 than you're paying in 2024. And part of that is because of the change in approach. The 2500 plan is a lower cost plan, like in actuality, right? The actual full premium for the 2500 is lower than the old H2000 was. So this is what I meant when I said the plan transparency, the price transparency. Using the premium credit strategy allows the folks in the H2500 to actually benefit from the lower premium comparatively. And so those folks will see a bit of a reduction. But on average, folks in single coverage will pay $15 to $25 more a month, depending on which plan they choose. And folks in 2-person or family coverage have single-digit increases or decreases, with the exception of the H2500, which is a larger decrease. So on average, there aren't huge changes because there's not a huge increase in 2025. Overall, HealthFlex did very well, and so there's not a huge increase. The church share, the proposed church share, is based on how much it takes to fund those premium credits, and the church share will be $1,508. The recommendation is $1,508 per month, which is a 4% increase. I'm going to answer a couple of the questions here. There is no actual gift card. That's just an analogy, right? So the premium credit, which I have listed back on this slide, the $867 for a single, the $1,563 for two people, and the $2,144 if you cover three or more people. That is the amount that the conference funded by local churches will contribute towards the health plan premiums. And when we look at the health plan premiums themselves, you'll see, I mean, this is the total premium, not just the amount that the member is responsible for. So the conference and the churches are paying a good chunk of the total premium cost. So that's what the premium credit represents. That's what the gift card represents. There's no actual gift card, but that is the gift card analogy. The premium credit applies to how much you pay to just enroll in the plan. And the goal is for everybody to be able to kind of transparently see how much their plans cost. I do have one individual who's asking a lot of questions, which I welcome. I'm going to try to get to as many of them as I can. It may be beneficial to kind of take some of those offline. So if you don't get 100% of your questions answered, we will figure out a way to make sure that you have a chance to have a conversation with somebody. All right, so let's see that premium credit in practice. So this is an example of two-person coverage. Their premium credit is the $1,563 a month, and the premium for the H5000 plan, if that's what they chose, would be $1,705 a month. If this example, they're going to waive dental, they're going to choose the no-cost exam plan for their vision, and they're going to happen to contribute $300 a month to their HSA because they've enrolled in a high deductible plan that's qualified to contribute to an HSA. So there's their premium credit. The total premium is $1,705 per month. So the participant is going to pay the difference, which is $142 a month, plus the $300 a month that they've chosen to contribute to the HSA. I want to point out that the premium savings by choosing this very lowest cost plan versus the very highest cost plan, the B1000, is $556 per month for two people. So that's a significant savings that they're experiencing every month, right? Every month they're keeping $556 more by enrolling in this plan. We'll talk a little bit more about this later, but my hope is that they're taking some of that and actually contributing to an HSA. And in this example, they're contributing $300 a month, which gives them $3,600 for the year. But maybe there's opportunity for more, and we'll talk more about that. So the benefits overall to this new approach, it's still fair and equitable compared to what you were doing before. It allows the conference in Wespath to be much more transparent about how much the plans actually cost, right? It's fair. It's right out there in front of you. We have a very fair strategy for pricing the plans based on actual claims we're expecting to come in from the conference. And this approach allows us to be transparent about this. It also, we think, will be less confusing for you because it'll match the information in ALEC and the AE election system with what you're being billed by actually what your church is being billed and what you're having withheld from your check for your portion. And also it allows us to sync the premium credit with how much the churches get billed in the future. And one of our questions was, is this approach more expensive for the church? And it's not. If you look back, the church is getting a 4% increase to the amount that they are being billed per month, which is very close to the 3% total increase across all the plans. And the only reason for the slight difference is because we are trying to equalize and change the approach by switching to this premium credit approach one time. So in the future, the conference will have the ability to determine how much the churches can absorb of the actual increase and how much to pass on to the individuals, and they'll be able to be very transparent about it. So it's not more expensive for churches, and it's just more transparent for everybody. I'm going to pause right here because this first section of the presentation is really focused um, on the recommendations of the staff and the Board of Pensions regarding how to approach the member cost share and the church cost share for the premiums of the plans for 2025. And I believe that this is going to be shared at annual conference. And so we wanted to make sure that there's an opportunity for everybody to understand it and ask questions about it, and really understand kind of the transition, the fact that, it's still very fair and equitable, just a different approach that allows for greater transparency and less confusion going forward. So any other questions about the pricing and how much is it individuals versus the church are going to pay under the model? Okay, I'm going to keep going because one of the other things, since we have you all, that we've been talking about with the conference is maybe taking advantage of an opportunity to correct some of the misconceptions about the plan that are out there and maybe some of the misunderstandings. And the biggest question that I've heard, and I've talked to folks from North Carolina, I talked to them personally before last annual conference. We've talked with your conference staff who's very invested in helping you understand your plan and making the most of it. One of the biggest questions is about how do you know that you're choosing the right plan? And then if you think that the right plan for you is actually one of these lower cost plans, how do you prepare for the higher cost of services? Because by choosing to pay less each month in premium, you are choosing to pay more when you actually need service. And I don't think that's a bad choice, but it's a choice that you definitely want to be prepared for. So it's super important to consider all aspects of what contributes to healthcare costs, right? The biggest one is how much you pay in monthly premium. And because that kind of happens when you make a decision one time in November, and then you just see it come out of your paycheck, before you even get your paycheck at home, so you almost can forget about it, or you certainly don't pay attention to it the way that you do to a bill that comes in the mail. This is, for most people, the biggest portion of what their healthcare costs are in a given year is how much they pay in premium. But there's also how much you pay for services, and that might be medication that you get. It might be a doctor's visit or an ER visit or a hospitalization. It's how much money is included in the plan that you select, because I'm going to share it with you in another slide. There are 4 plans that come with money in an HSA or HRA account. So you definitely don't want to discount the value of that money when you're thinking about your total healthcare picture. Mm-hmm. And then there's the worst case scenario, right? Most people do not hit the out-of-pocket maximum. Most people do not even come close to the out-of-pocket maximum. It's like 5% or less that are come is that close. But as somebody who's hit the out-of-pocket maximum, my daughter hit it this year already, like that matters, right? That's like, how bad could it be? And so all of those are important pieces of thinking about, what is healthcare going to cost me for the year? And how can I think about that, all of these aspects when I'm choosing what plan to enroll in? This is the slide I referenced. I wanted you to see that for 4 of 6 of these plans, we will give you money just for enrolling in the plan. We will give you money in an HSA or an HRA that you can use to pay for some of your out-of-pocket expenses. So if you're not using that money, then you're missing part of the benefit of those plans. So make sure that if you're enrolled in those plans, that you're paying attention and you're using those tax advantage dollars in the health account. Okay, so we have the same benefit options available to you in 2025 as you have in 2024. One thing, I'm going to take a little step back in time when at the end of 22, beginning of 2023, when you transition to HealthFlex the first time. The previous buy-up plan that you had, so you had 2 plans, and the buy-up plan was by far most similar in price and value to the B1000, which is our most expensive plan. If you had the base plan in the past, it was kind of close to the old it was a kind of between the old H1500 and the old H2000. So the closest plan now is about the H2000. So those are two gold level plans, right? The H2000, the B1000. Those are gold level plans. Those are among the most expensive plans for HealthFlex. Those were the plans that were most similar in price and how much they covered to your old plans. But I just said previously that currently most folks in North Carolina are enrolling in the H2500 and the H5000, or in the past in the H2000 and the H3000, which are the two lowest cost plans. So it's not a surprise to me that some people are thinking, wow, our plan doesn't cover as much. It's because many of you have chosen to pay less in premium each month than you would have in order to buy a lower cost plan, and maybe or maybe not have fully prepared yourself for paying the additional out-of-pocket costs for services. So what if you're wondering, like, why on earth does HealthFlex even offer those lower cost plans? They're nothing like what we had before. They're scarier. I have to pay more out of pocket. Like, why do you even offer them? Well, this is why. This doesn't include North Carolina claims because this is based on 2022 claims and you weren't with us yet. But we will be repeating this analysis this summer with 2023 claims and 2025 plan designs. And we're happy to share that with your conference staff and and trickle them down to you as well. But when we look at actual claims incurred by people in HealthFlex, by 10,000 families in HealthFlex, right? And the 2024 plan designs, premiums, and cost share, what we see is 2/3 of the population is financially best off in that lowest cost plan. Most people overinsure and choose these more expensive plans, but the vast majority of people are best off in these lowest cost plans. And you might have seen that in Alex, and you're like, well, that's why I picked it. What may or may not have factored into that is how much you are saving in premium compared to what you would have had if you would have continued on in your old buy-up or base plan. And I'm not sure if everybody was taking advantage of the opportunity to take that savings and actually use it to feed an HSA and use it to pay for those higher out-of-pocket costs. So let's go back to this prior example. This is the same example as I showed you before, with the two-person chose the H5000. I mentioned, so these were the ones that are similar to your old plans. That if you're saving $556 a month over the B1000, and while $300 a month is great to contribute to the HSA, that gives you $3,600 at the end of the year in HSA contributions, but it's not enough to even meet one person's out-of-pocket maximum. If you were in the buy-up plan before and you bought down to this H5000 plan and you contributed the full $556 a month to the HSA, you'd have $6,672 in HSA money to spend on out-of-pocket costs. And since most people do not hit their out-of-pocket maximums, then most people will not spend this whole $6,000 in HSA, and they'll be able to save some of it and roll it to the future. But let's say you weren't in the buy-up plan, you were just in the base plan, it's still $411 a month difference for two people in the H2000. And so if you save that whole $411 a month in your HSA, at the end of the year, you'd have almost $5,000 in your HSA, which would cover one whole person hitting their out-of-pocket maximum. So again, I don't know what's right. What's right is different for everybody, but I wanted to make sure that folks understand that when you're saying, wow, these cover so much less, it's true that the lowest cost plans do cover less, but they're just options. They're not for everybody. And if having those higher out-of-pocket costs, not having co-payments is overwhelming, then that could be a reason to choose a higher cost plan. So I have one individual that says, can we get an example of the H2500? And we can definitely send that as a follow-up. We'll do the math for you and share that. I won't be able to do it on the spot because I do math terribly in front of people. I need to at least have a minute to myself to do it. But we can definitely follow up with those examples. But I wanted to show you for all plans, if you're single, what the worst case scenario is, and then if you have a family coverage, what the worst case scenario looks like. I didn't do the two-party, of course, which is the one that somebody asked for, but I just wanted to show these illustrations for kind of so you can see why often most people are better off in these lower cost plans. So to be on these plans, I've included the monthly premiums, but remember, for a year, you pay that 12 times. So when I added it all up, I multiplied that top row by 12. Now, I didn't include how much your employer pays in my calculation because you don't even have to pay that part. But here you can see like side by side how much you're paying to be on the plan versus how much the conference and your church is paying for you to be on the plan. And the church is picking up a significant portion of it. I included how much money you get in a health account for each of these. And of course, the out-of-pocket maximum for all of the plans is the same. It's $5,000 for one person and $10,000 for a family, which is a scary number. But if you have catastrophic health expenses, I promise that is a welcome number, a number to know that if your child is hospitalized for 2 months, that you're going to be responsible for $5,000. For me, that was a huge relief. And I know I'm guessing that for many of you who have faced similar situations, like having that out-of-pocket maximum in a bad year is a huge relief. So in this example, single coverage, worst case, hit the out-of-pocket, had hundreds of thousands of dollars of claims. Your worst case scenario is between $5,372 for the year if you choose the lowest cost plan, and $8,876 for the year if you choose the highest cost plan. So there's a swing. I mean, there's definitely a value to choosing a lower cost plan, but if the comfort is there for having co-payments, then this is the worst case scenario difference, right? Is you're paying about $300 more a month in premium to be on that highest cost plan. That adds up to about a little over $3,000 a year that you're going to pay to be on that highest cost plan and have that comfort. Same scenario here for the family. So the worst case scenario has a $10,000 out-of-pocket max. That means, 2 or more people in your family had an awful year, right? We include the premium, how much the church or conference is paying, how much you get in a health account. So you can see worst case scenario for a family goes from about $12,280 if you enroll in the lowest cost plan, up to $21,400 if you choose the highest cost plan. Most people will not have this much in expenses, right? Because fewer than 5% of you will hit your out-of-pocket maximum. But this is the worst case scenario. And this is why how much you pay per month matters so much. It's a huge contributor to your overall annual spend on healthcare costs. So that the B1000 and the H2000 are the closest to what you previously had. So all of those other options to pay less are only available because there are lower cost plans available. Now, like I said, most of you are not going to hit the out-of-pocket maximum ever. Lucky, thank God for that. Alex is a good tool to help you estimate from your for your own personal situation. It's available every annual election. It's funny, kind of, they call them dad jokes, right? No offense to the dads who tell amazing jokes. It's about 20 minutes all the way through. It uses simple language. It recommends not only your lowest cost plan, but how much you might want to contribute to a health account to fully fund your out-of-pocket costs. So if you're using Alex and you're saying, hey, Alex said I should enroll in the H2500 or the H5000, and I trust Alex and I'm going to go for it, please also listen to Alex's suggestion in terms of how much you should contribute to your HSA, because that's important as well. So kind of the moral of this is that we really strongly recommend that at least in early years, you contribute what you're saving in monthly premium by choosing a lower cost plan to your health account to prepare you for those higher out-of-pocket expenses. For example, I mean, it can be painful in those first couple of years to max out your HSA, but that's what my family has done because we know we're going to have high health expenses, right? We know we've chosen a low cost plan. We know we're going to have a lot of out-of-pocket expenses. So we maximize our HSA contributions so we have the HSA money to help us pay for those out-of-pocket expenses. And that is what we strongly encourage those of you who are choosing to buy those lower cost plans to go ahead and do. I'm going to pause there and see. I have the one family that has a bunch of questions, and I'm happy to kind of take those offline. But otherwise, we don't have a ton of questions. So I'm going to move on. I wanted to share a couple of other things as well, which I hope, address maybe some of the misconceptions about the plan. First of all of the plans have care coordinator support. And I want to be very clear, this is very high touch assistance. Anything from, I can't find my ID card, or I need a new ID card, or, hey, my provider isn't finding that my coverage is available, or I'm not really sure what I'm going to pay for this, to, hey, this bill doesn't seem right. Can you please take a look at this and see if the plan actually paid what it was supposed to? Or how much might the plan pay in this scenario? Or how can I choose a provider who's in network so I can get the best possible benefit? We really encourage you to call your care coordinator first before you contact the conference office, before you call Wespath. Not because we don't want to help you. We do. And I guarantee that your benefit staff in North Carolina wants to help you as well. But these guys, the care coordinators, have the most insight into the claims and into what might have been submitted or what approvals might have been submitted, and they will be able to help you the most. And so we strongly encourage you to call them. We've heard a couple of a very small handful of individuals who've struggled with a care coordinator, and Wespath will always intervene if that happens. But we've had thousands of people connect in the first 2 quarters of the year with a care coordinator, and overwhelmingly the feedback has been very positive about what they've been able to, the assistance they've been able to get. The other thing that I want to underscore, because perhaps you're thinking to yourself, wow, our healthcare premiums are already really expensive because healthcare is really expensive. And now you're adding this high touch service. Like, doesn't that just make it more expensive? And the answer to that is actually no, because when we are better utilizers of our health benefits, we are able to actually be better stewards of the healthcare dollars, and it actually ends up costing the plan less in the long run. And so what we've seen in our peers in other denominations who have done this before us is that they actually saw more than a one-to-one return on anything they paid to hire the care coordinators. They saw the return in terms of a reduction in overall claims, and not because they're just denying claims, right? It's because they're helping people to better use healthcare in a smarter and better stewardship way. So this is available to everybody, no matter which plan you enroll in. Another thing I wanted to talk about is mental health support, because I have, I've heard that the impression that HealthFlex doesn't really offer good access to mental health support. And where you're coming into barriers, I'd like to hear that, because I promise you, this is actually an area that we work very hard to have more than industry standard generosity when it comes to benefits. So there's 3 ways to access mental health support covered by HealthFlex. 2 of them are at no cost to you. The first is through MD Live. So if you access MD Live through Benefits Access, make sure you go through your HealthFlex single sign-on and not, or log in through your HealthFlex account and not, go directly to mdlive.com. You can see a counselor or even a psychiatrist, and we will pay for 100% of it as long as you're the age of 10 or over. So this was true in 23. This was true in 24. I hope it can be true in 25. It depends on some rules that Congress has to pass and extend. So this is something, we're just trying to improve access. Not everybody wants to go do virtual mental health care, but this is available to everybody 10 and over. No cost access to a counselor or a psychiatrist through MD Live. We also have the EAP. It's not the most robust network, but you can get access to somebody at no cost. 8 visits per year, per issue, per individual. And this actually covers people who are in your household who are not on our plan. So if you don't cover your spouse on our plan, but your spouse needs to use the EAP, your spouse can, even if they're not covered under our plan. You have to be covered to use the MD Live services. But what if you just have this counselor that you love and you just want to go to your counselor that you love and they're not in the Blue Cross Blue Shield network? And there are many behavioral health counselors that are not in the Blue Cross Blue Shield network. There are many behavioral health counselors that are not in any network. Most plans, and this is true for even our denominational peers in other denominations, they use still a network. But HealthFlex will pay the in-network rate for mental health counseling, even if for outpatient mental health counseling, even if your provider is not in network. So if your provider is not in the Blue Cross Blue Shield network, we will still cover that outpatient counseling visit. The only thing is if your provider is not in network, you do have to typically pay the claim up front and then submit it for reimbursement. Now, I'm aware that there were some individuals who didn't have their out-of-network claims adjudicated properly at the beginning of this year. It is also my belief that those have all been identified and re-adjudicated and corrected. So if that was you and you don't think that yours has been corrected, please reach out to your care coordinator. And if you're not getting the answer you want from your care coordinator, please let the conference or Wespath know. But HealthFlex pays in-network outpatient counseling no matter who your provider is. And we do that based on billed charges, which is really rare because usually the approved allowed charges for a mental health visit, like in the Blue Cross network, are maybe like $100 a visit. Like that's the discounted agreed upon rate for an in-network provider. If your out-of-network provider bills $200, we will still apply your deductible and coinsurance or your copayment, even though your provider is charging way more than an in-network provider would do. And we do that because it's important to us for all clergy and their families to have access to good mental health care. So I'm hoping that this clears up some of the misconceptions. If you heard somebody talk about how like the mental health care in HealthFlex is terrible, I hope that this, gives you a different perspective. If you knew this and you still feel like it's terrible, I hope you will reach out to us as a follow-up to this call. Because like I said, we work very hard to have comprehensive mental health support in HealthFlex. And if something's not working, we'd like to understand that better. I don't have a slide about preventive care. I have one of our questions is about this, this plan doesn't cover preventive care. And I definitely want to understand that better. So I hope that the individual who shares that will share some specific examples. But regardless of which plan you enroll in, true preventive care is covered at 100%. So that's your wellness exam every year. That's your age-appropriate vaccines, your age-appropriate screenings like colonoscopies and mammograms and things like that, pap smears. So 100% coverage regardless of what plan you're in for preventive health. Now, if you go get a wellness exam and you get charged for it, I encourage you to call your care coordinator because they can help you identify whether like the provider billed something that was not preventive or whether there was some other aspect of the service that you receive that is not traditionally considered wellness. They can help you understand that. And if your provider made a mistake, they can reach out to your provider and help them correct it so that you don't pay the penalty for your provider's mistake. I will tell you, my son has a chronic medical condition, and his provider also bills us for the ongoing management of that every wellness visit. So we pay for in addition to his wellness care, his wellness visit is at 100%, but we pay annually, a portion to have his pediatrician manage his chronic condition. And sometimes that's the case, and sometimes your providers will stand by that. They should tell you it, but not all providers do. So it's a good opportunity to have your care coordinator help you kind of explore that and understand it better. The other thing about preventive care, so for folks who are in the HSA plans, it's an IRS rule that medications have to be subject to the deductible. So you have to meet the deductible before the plan can pay for the medications. The exception to that is preventive medications. And again, HealthFlex doesn't have to exempt preventive medications from the deductible, but we don't want it to be hard for you to take care of yourself. And so we've chosen to make the preventive medications pay before the deductible in all the HSA plans. We don't choose what medications are preventive. OptumRx makes that decision. They have the necessary healthcare professionals on staff to do that. But I just wanted to share, there are many ways that we work hard to make preventive care accessible to you. And then I have 2 slides on the well-being programs. These are all included in your plan premiums. So Virgin Pulse, I said that many of you take advantage of this, but did you also know that you have a diabetes prevention program, which can also help prevent other chronic conditions like cardiovascular conditions, a diabetes management program if you've actually been diagnosed with diabetes. We have telephonic health coaching. The Blueprint for Wellness screening I mentioned is available. It's a very comprehensive blood screening, great to bring to your wellness exam, and we will pay for it in full, as well as give you $100 to do it. So we strongly encourage you to take advantage of that. We have the Employee Assistance Program, which we talked a little bit about, and the work-life services that are part of that. MD Live, we talked a little bit about. That $0 cost for MD Live is not only for mental health, but also physical health concerns. So if you have a rash or some kind of a skin condition, an ear infection, something like that, you can call MD Live. It's great when my child always seems to get sick Sunday afternoon, right after the pediatrician's Sunday office hours have closed. So it's nice to have an option for those off hours. And then we do also pay for 50% of Weight Watchers, now called WW, membership fees. So I hope that this has been helpful. We don't have a ton of questions, which we welcome, and we'll open it up after this for Q&A. Our primary purpose in coming to you today was really to talk about the new approach for cost share, which is not a huge change, but we wanted to be transparent about what the change is, moving to the premium credit model for 2025. But since we've been together, I hope that some of these other things that we've shared have been helpful in better understanding, how you can prepare for the plan that you've chosen, how you can, if you choose a lower cost plan, how you can, comfortably live with the fact that you don't have co-payments, right? Because it is scary in the beginning to not have co-payments, but if you're prepared for it, I think it's less scary. I promise you that the folks on my team care immensely about the people who are in our plan. This is what we've chosen to work at Wespath instead of at a for-profit insurer, because we want to help people and we want to help clergy who serve others. And so we work very hard to create a plan with comprehensive benefits that will help you and will serve you no matter what your healthcare journey, where your healthcare journey takes you. And we work very hard with your conference to be a good partner and to help us all be good stewards of those dollars that go to pay for health benefits, because it's a big chunk of what your church is paying, and it's a big chunk of what you are paying. And so we want to make sure that we're providing benefits that are fair and comprehensive and are really going to serve you on those health journeys. That is all I have for you today. Are there any other questions? Anything that I didn't, anything I didn't answer?
Kelly, this is Bob. Just really quickly, we have a couple follow-ups that we'll get back to individuals. So if we told you we'd get back to you, or if you have a question that we didn't address, rest assured we will get back to you with those. Also, as part of signing up for this webinar, when the recording is available, you will get an email. If you have questions that you think of later, you can always respond to that email and someone will get back to you with an answer.
Thanks, Bob. We do have a question about the premium credit, and I'm going to go back a few slides and walk through it again. And if you know, it never hurts to hear this a few times, and so I'm sure that everybody can benefit from hearing this again. After this, if you still have questions, you know, let us know, and we'll have somebody maybe give you a call and walk you through it in your specific situation. So the premium credit is a fixed amount that the like that gift card analogy, right? That the conference has designated for the employer, your church, the conference to pay to help offset the cost of premiums. So we saw these are the actual premiums for 2025 for your 6 different plans. These are the actual premiums. But the conference is going to cover a good chunk of that so that the amount that the individual is responsible for paying is this. And remember, we will share these slides, so you'll have these numbers to compare. The difference between this, the total, and the amount the member pays is this in the purple box, which is the premium credit. So if you subtract the premium credit from the total amount that we're charging, the Wespath is charging for the premium, you subtract the premium credit, that's what the member portion will be. And when I say who's responsible for the premium credit, the conference is going to choose to bill the churches this 1508. I have it somewhere, right? Where did I put that 1508? It's on some slide. The conference is billing the churches, there it is, the 1508 a month. And that 1508 is not the same as anyone's premium credit, right? You saw the premium credit. Nobody has 1508 as their premium credit. What 1508 is the amount that the conference needs to bill each church in order for every pastor who enrolls in single coverage to get $867, every pastor who enrolls in two-party coverage to get $1,563, and every pastor who enrolls in family coverage to get $2,144 a month. So the church is funding that based on what the conference is choosing to direct to the church. And the conference could tell you better if there's any subsidy in it. I know that in the past, there may have been some subsidy by the Board of Pensions, and other conferences have that where sometimes the conference has to subsidize it. But it's selected by the conference. It's primarily funded by the local church. I think that answers that question. Are there other questions? All right, there are not. Well, we are super grateful to you for spending an hour with us today. I do sincerely hope this is helpful. If we've confused you, you know, I hope you'll reach out, but more likely if we've clarified some things for you, I hope that that's helpful and it gives you more confidence going into, you know, conference and going into your 2025 plan selections.